Welcome to a new episode of Science in Context. I'm Sabine, and this week, Rosie Maddren and Professor Sir Roy Anderson join me to speak about helminth transmission and control. Rosie, what are soil-transmitted helminths?
So, soil-transmitted helminths, or STH, is an umbrella term that refers to 4 species of worms which are estimated to infect about 1.5 billion people globally, the majority of which are children. This is almost a quarter of the world's population, but it is a treatable disease. A single drug dose can clear the infection from the host stomach. However, being infected or being treated does not provide any immunity to the host, so people are often reinfected again and again. This infection or transmission occurs in areas with poor access to sanitation and hygiene. Therefore, the prevalence of these worms is closely linked to poverty.
Roy, what is the current state of STH control progress?
We've been very lucky in having donors provide drugs free, that's pharmaceutical companies, and worldwide the infection prevalence has been reduced greatly. So we're now at low levels of infection, and the challenge now always, as with most infectious disease, is moving from low to trying to eliminate transmission.
And Rosie, the World Health Organization has called for enhanced monitoring and evaluation and recommendations for assessing this progress towards this target. How does your current work help with that?
So as the prevalence decreases, the transmission characteristics become really hard. It's hard to measure and identify the final pockets of infection within a community. So the work in our paper investigates the best way in which to measure the impact of STH control programs in these areas of reduced prevalence. In particular, our paper looks at the most appropriate spatial scale in which to validate this low infection. And hopefully this will go to provide evidence to inform future WHO control guidelines.
Thank you both so much for your time today.